The perspective is really around how we think about data as a paradigm that we can draw from economics, in fact, microeconomics, the supply of data and the demand of data, and how we can use it to accelerate insight extraction in the field of cancer in particular. I'd like to start just by acknowledging many individuals who have contributed thoughts and concepts to this presentation, but in particular, I'd like to acknowledge the Digital Health and Discovery Platform proposal writing group from the Terry Fox Research Institute in Imagia, which I really enjoyed working with almost 2 years ago now when we drafted this proposal. And I'm going to draw on components of the proposal in the presentation to try to illustrate and relate some of the concepts that I want to bring forward. There's an exciting time that's happening right now where data is becoming something of real value. We've seen it all around us for many years, but it's starting to become something that's emerging really from a paradigm called the data economy. This is highlighted just over the past year in many articles, whether it's Time or The Economist, where the process of generating data from one's personal life is really starting to become something that can be seen as a bit of data capital moving forward. It can be owned, it can be controlled, it can be inherited and bequeathed. And in the digital world, the act of changing state from 0 to 1 or 1 to 0, owned and managed by individuals. And in the context of healthcare, this is very important because it's the observations associated with individuals and their health that actually inform us quite substantially around how we can make improvements to healthcare, and in particular in the context of cancer, learning from patients who go through care, getting insights and driving those to new discoveries that led us to accelerate progress against cancer or many other diseases. And is really driving the development of technology to manage consent for use or digital rights or derivatives of this kind of data. It's an exciting time in many ways. And I like to sort of think about this from a supply and demand paradigm, and I'll relate this back to the DHDP in a future slides. And if you remember your microeconomics from high school or undergrad, if you took that, there's always a law of supply and demand, and it's a theory that explains the interaction between the sellers of a resource and the buyers of that resource. And the theory defines a relationship between the price of a given good or product and the willingness of people to either buy or sell it. Now, of course, there's some sensitivities when we talk about buying or selling data, but those sensitivities are really coming to the foreground. If you've seen the recent presentation at the end of January by Tim Cook, where Tim basically in this description of their intention at Apple to start to shift the way we allow cookies to be managed and accessed. And that data, which is constantly being shed by those who are on the internet as they go about shopping or doing whatever else they're doing in this pandemic lock-up world right now, it's become incredibly valuable. In fact, Tim's comments has generated a bit of a battle between Facebook and Apple, because Facebook substantially lives off the digital droppings, the zeros and ones, generated by humans to run its ads business and to sell product. So clearly there's a market at play here. And in a forming economy, microeconomic theory highlights the factors and time periods required to get to a supply-demand equilibrium. And in the context of that data economy, we're quite a ways away from that, but it's starting to change. Advances in measurement technology have dumped vast quantities of data into a nascent marketplace without a structured interaction between sellers or buyers, or in an academic paradigm, even among collaborators, how we formalize collaboration. And as we use data more and more in these collaborations, how do we formalize data collaborations? And this is a very rapidly changing space that I think is going to be substantially enabled by the DHDP. When it comes to healthcare in particular, I'm currently in the US and I'm learning a lot about things like HIPAA. It was back in the 80s, the early 90s, pardon me, that Bill Clinton signed the HIPAA Act, or the Health Insurance Portability and Accountability Act. And that legislation was intended to help individuals maintain their health plans and combat rising costs. But more importantly, it actually became the rules by which health data can be accessed. And this data has become very important, very interesting from a real world evidence paradigm. But it's also becoming very interesting from the perspective of, is it appropriate for companies to be able to access this data for uses other than specifically for care? And there's a great example where we're seeing more and more data being shared with large organizations such as Google, some 2.3 million records between the University of Chicago Medical Center and Google from a data sharing perspective under the HIPAA framework. In fact, this is actually being prosecuted in a federal lawsuit right now. A patient challenges or alleges that the HIPAA-based arrangement is in fact a breach of the individual's privacy rights. We've seen it go further with Ascension's 50 million records and Mayo's 9.9 million records. So there's a real questioning coming about around how do we use data and what rights people have on it. This was highlighted just last year, this time in the Wall Street Journal, where asking questions around the use of this data in terms of the Google Ascension arrangement. And it says legally the information gathered by Google can be used for purposes beyond diagnosing illnesses, the laws that were associated with HIPAA. But there's a real question. There's little or no input from patients in this process, and there's no real understanding of the intention to share this data with certain outside companies. And so this is kind of highlighting this really immature economy that we're in with respect to healthcare data. And this data is not just useful for the delivery of care, it's obviously very useful for advancing research. In Canada, though, of course, it's been quite a while. 1992, when the patient is entitled to their medical records, you can extract it, you have access to it. There are guidances within Canada that require that or allow hospitals to charge a fee for that process, but it's a regulated activity. And this is a space where Canadians are actually more than able to extract information from the healthcare system. In the United States, it's not so clear in terms of the ownership laws, or at least it wasn't so clear whether or not they could extract information. This just highlights across the United States the differences between medical record ownership laws are clear. Hospital and physician own medical records, patient owns in New Hampshire. Otherwise, there are many states that have no clarity whatsoever. That's changed quite recently, and I'll get to that in a second. So the question is, like, who owns the data? Who could use data? Open data for healthcare is a very hot topic. People want to share the data because they think it's for society's good, and it's a challenge to sort of, project that on society as an expectation. But it's not even clear how would one go about this. Is it a public and citizen engagement conversation? How do you make sure we understand who's using it for what? What's the framework, regulatory framework for this? And what are the implications of data structures and big data analytics that are emerging? And is there an entire training and education paradigm? This is highlighted in this very helpful article by Koslova back in 2016. I encourage people to take a read through it because it really does speak to some of the challenges we're facing when we think about creating a national infrastructure for which we can use to sort of advance healthcare using digital tools, but also advance the discovery agenda. These concepts are critical. In the United States, just at the start of the pandemic back on March 9th, 2020, they issued guidance regarding what's referred to as sort of the information blocking rule, or the Cures Act. And the Cures Act very specifically says that all hospitals and health organizations now have to stop any kind of information blocking. No longer can they restrict in any way the flow of information that belongs to a patient from their organization to a patient. And this is quite a remarkable shift over the past year. And as an organization in the United States, we've been wrestling with this to try to make sure that we are not in any way impeding the flow of information to patients. So the patients are going to become much more active. And an entire economy around how that data is used, extracted, and so on is going to start to form. And I think this is a trend that we will see globally clearly, and the technologies associated with this policy change are going to create an environment that we need to think about how we can engage in it to really advance agendas like things like finding a cure to cancer. Just to note that in this information blocking specifications, they've also provided core data for interoperability is also specified in the Cures Act. And it goes further than just things like demographics and so on and healthcare data. It actually speaks to the provenance. So having the provenance element start to be embedded in policy is quite remarkable. And so it starts to think about what kind of technologies are we going to need to support this. From a scientific perspective, everybody's excited about the FAIR principles: findable, accessible, interoperable, and reusable as an approach by which scientific data can be managed. And I think from that perspective, if it's science data, but not necessarily healthcare data, there's a conversation around how that's feasible. But getting data to be open in a way that actually satisfies the consent and potential encumbrances on that data is not an easy task. Sounds great, but it's technically extremely difficult. And we need to imagine the development of different technologies that allow robust and efficient execution of the FAIR principles. It's not as easy as it sounds. It sounds like we're just going to throw it over the fence. It's actually a ton of thinking has to go in to make sure this is robust. And I think without these technologies, the confident use of data will not be possible, and the result of value of data will not be fully realized. Of course, understanding whether or not we can share data in an open paradigm is one thing. Going beyond that, we also want to understand where it came from to know whether or not we can believe in the insights that are extracted, or furthermore, can we trust technology that has been sold to us to actually continue to work properly? Where did the data came that trained those platforms? This is highlighted by speakers before me, but the point being that the same technology that's going to allow us to figure out whether we can use that data will also provide the lineage or the thread or the provenance to understand where that data came from. Is it still valid to use that algorithm in this altered cohort of individual patients, and who consented for its use? And as we see the advance of software as medical device paradigm and the FDA really trying to understand that whole cycle for release and use of data as data changes and doesn't have stationarity, how do we continue to support and apply these technologies? And in the real world paradigm, a desire to reveal and address bias. Real world evidence has the potential to really look at some of the biases that are intrinsic in the approach we currently use to approve new drugs or interventions, where we identify specific cohorts and we use those to predict impact on broader populations, when in fact the real world data has a divergent result. So accessing real world data allows us to see that variation in the wild and to better expect or anticipate the impact of our interventions. This is going to be critical moving forward. But that real world data is going to come from somebody. And how is that going to be structured? How are we going to have confidence that we have the rights to use it appropriately? And how are we going to know it's real? It's pretty easy to make fake photos and fake everything else in the future. Tracking and having confidence in the data used in a real world paradigm, I think is going to be critical if we're going to rely on it moving forward. So one thing that we know for sure, and we've highlighted in previous presentations, is that the development of machine learning technologies have accelerated the growth in demand for data and highlighted the vulnerability to quality. So that's no question. We see that the AI technologies have massively increased humans' ability to consume information. The big challenge is that's a demand side. The supply side is incredibly weak. It's incredibly immature. And until we build up that supply side, it's going to be very hard to get to a point where we have this demand supply equilibrium. Once we get to that equilibrium, it could be a very virtuous cycle where much more engagement is achieved in the process, and we can really direct and target which data is most important to answer the questions. And that's a healthy economy. So beyond the demand, how do organizations, which two things need to be done. Organizations need to invest in their internal data supply chains. Those will be the best partners for all their stakeholders, whether it's a collaborator from an academic point of view, or a patient, or an insurance company or a provider. Proper data governance or data supply chain management within an organization is a key enabler to allow those organizations to be successful in their pursuits. The second aspect is the development of data governance technologies. These are going to be required to establish high performance data supply chains. When I say high performance, it means consent, understanding the quality of the data, understanding where it came from a provenance perspective, but also making sure that you can structure findability and access in an efficient way to allow those interactions and those collaborations to be efficient. You can imagine an entire world where legal agreements are auto-generated to allow data collaborations to become efficient with so-called data governance technologies allowing that to happen. When we wrote the Digital Health and Discovery Platform proposal with the team at Imagia and Tecna and many others, it was actually a very inspiring time 2 years ago, working late into the night. We had many of these paradigms active. And the figure is actually from the grant. And it shows the idea that within each member node, we have mechanisms by which people can integrate data, curate that data, and then expose it to collaborations across a wide network so that we can learn together more efficiently. And so the Digital Health and Discovery Platform provided data sharing and exposed that information to machine learning. It's designed to allow semantically supported findability, access, interoperability, and reusability of the FAIR principles to be realized. And it really starts to create this connection between demand and supply. And I think one of the things we really need to think about was, for the organizations that are participating, how do you mature that supply capability in the organization to allow that data to flow to those collaborations which we know will advance the agenda in the fight against cancer? So organizations need to invest in an internal data supply chain paradigm. And those of you who, of course, have ever done anything in the technology space, I have this quote. Drucker, we all know, culture eats strategy for breakfast. From personal experience, I'm sure several of you who know me have seen me experience this. When it comes to data, governance eats technology for breakfast. And I've seen this over and over again. And so we need to think within organizations, what's the approach to governance of our data? What's that data supply chain look like? And how can we be structured to participate in this economy of either buying and selling of data, not so keen on that one, but entering into very effective data collaborations? I mean, from a data governance perspective, there are many challenges in the cancer research domain. The infrastructure is a challenge. There's siloed clinical and research data separated by legal and intellectual property requirements and security and confidentiality restraints. Heavy reliance on manual documentation, hybrid paper and digital health record environments. And the infrastructure is often ill-equipped to integrate and capture heterogeneous and large-scale data. And as part of the DHDP, creating a kind of a package, an infrastructure package that could connect in with the organizations was seen as an approach to try to tackle this. Also, the pace of innovation is a challenge. Unprecedented volume of data generation in cancer research over the past decade. The need to support high throughput methods, next generation data, different varieties of data, next gen sequencing, richer data, access to raw data. But in many ways, that pace of innovation is supported by huge advances from the machine learning and AI world. The ability to consume and extract insights is there. The challenge is really getting the data up at a quality that can really inform that. And many data scientists spend 90% of their time doing data curation and 10% of the time doing data science. It'd be great if we can get that to at least 50-50. And fundamentally, the process is a huge barrier. Data sharing mandatory for funding, but there's very little guidance on how to accomplish this. Developing policy and governance systems to share data are costly and time consuming, and they aren't necessarily consistent across organizations. Data access procedures and governance work well for individual projects, but as soon as you try to connect across those silos, it becomes very difficult. And this was the thing we tried to tackle with the overall framework of the DHDP, the idea that within organizations you could have data consistently collected, hopefully ontologically aligned, but then have the ability to find that data from across the network to enter into agreements and collaborations to advance the agenda on cancer research and more beyond cancer, but cancer really the icebreaker to allow this to come forward as highlighted in the proposal. I'm now at MD Anderson, and it's a pleasure to be there. I thoroughly enjoy the work. They're great people to work with. And actually, when I arrived, they had already developed a data governance paradigm, and we now call it version 1.0. And it was like many organizations where it was motivated by technology. Interestingly, a lot of data governance frameworks come into place because people pooled data. And once it's pooled, you need to have a process for governance because the technology does not separate the data like it used to. When it was under your own desk, who needs governance? It was your own machine. But when it's pooled, you need governance. So many organizations lit up data governance initiatives to try to help structure the data because the technology allowed us to bring it together. And this was done at MD Anderson. This has highlighted some figures from a paper back in 2016. It just talks about that framework. But it didn't talk about the flow of the data. It just really talked about the fact we've got to deal with data now that it can be pooled. We've recently launched what's called Data Governance version 2. And it really takes a look at the broader process-related implications around data governance, how it affects so many different things. I'm not going to go through all these, but it affects things like how do we participate in open science agenda? How do we know the data is not encumbered? How can we realistically share that? It affects our ability to get grants. But more and more, the ability to govern data organizations is going to be important to be successful from a grant funding perspective. It affects how you can recruit people. If you can structure the data for access, it's hugely attractive. And we've seen it in the open data paradigms like the ITB2 initiatives and so on at Harvard where data is available. It's incredibly powerful. That's really key for allowing organizations to be successful. Also addresses the issues around encumbrance. If that data is encumbered, can you actually do what you want with it? And how do you know for sure that you're really understanding what the intention of the patient was and their contributions to this activity? So transparency is another key factor. So we've started to really build this out within MD Anderson, looking at a team data science paradigm where it's cultural alignment, processes, and technology. And the three parts of this slide surrounding the team data science are research questions and teams. Those have always existed. And on the right side, we've now really started to structure our approach. That's something we call the context engine, where the data is kept in context using approaches related to dynamic ontologies and metadata support. It really structures how the data flows. And we think about it as an asset for further investment and improvement, constant curation paradigm. We've established some principles to help us guide us in this trajectory. And remarkably, what happens is more and more, it becomes more and more critical that data science capabilities are present. So it really brings these three legs of the stool together. Important research questions and teams, the flow of data in a structured way that has a known quality, but then the need to escalate data science capabilities within the organization moving forward. This just kind of sort of a bit of a structure here to kind of highlight the idea that a chief data officer is a role in the organization that really looks at how to curate and manage the data as an asset, sort of steward its value. It's on the left side. And rich data sources, whether they're clinical, internal, or research data sources on the right side, and flowing those data sources through to mechanisms to access those data sources in an efficient way with known quality through a data governance and provenance office that has a dedicated ontology team, a data quality team, and a compliance team. And that office connects very closely to the digital architecture team to make sure the technology is in place. And the technology doesn't get ahead of the governance, and the governance makes sure the technology is tracking to what the individuals in the organization wants to do. And this can't just be done top down, it has to be done bottom up. So subject matter expert engagement from the very beginning and reflecting the engagement of academics in the process is key. But this is the direction I think that organizations have to go, and it's going to be an expectation moving forward. So organizations have to invest in their internal data supply chain. And the structure of the DHDP and the technology stack that was identified could help organizations across Canada invest in that supply chain, but a lot of process-related activities have to be developed. Another key component is the data governance technologies. We really are immature still on the technologies we can use to actually allow those processes to work and allow that interaction to be efficient and effective, that allow us to get to that supply-demand equilibrium. Within the DHDP, we identified data governance technologies as an important part. How do we achieve open, findable, accessible, interoperable, reusable principles? In fact, we defined something called the findability and access layer, and we used NASA's technology readiness level, declared it as a 1-2, as in it doesn't exist yet. We need to figure it out. It needs to come along. In fact, we called it the magic layer. It's an acronym that stands for mapping of data to graph incorporating consent and governance control. And it's also called magic for other reasons because it has to be built. There's a very early hints of the technology that thinks about using graphs to manage data, but also get graphs to manage consent, including to support for metadata. And this is actually a figure on the top right corner right out of the proposal, and to enable those kinds of technologies to sit within organizations to allow data to be ingressed, to be mapped, and then to be found and accessed to really bring that data collaboration opportunity forward. And this is now maturing quite nicely. Well, we wrote this a couple of years ago. It's a really nice article by Georgia Tarasi's group on knowledge graph-enabled cancer data analytics. Many people have dabbled in the space for quite a while, but it's now becoming, I think, something that's robust moving forward. And I'm just delighted to see that ICED is invested in the idea of developing approaches that will lean heavily on graph-based approaches moving forward. It doesn't mean that we can't use the deep learning paradigms. It's very clear that graph-based neural nets can definitely be achieved and pursued. It's a really nice review article by Wu back in 2019, just talking about all the advances we've seen in the sort of image-based convolutional paradigm that we've seen from a deep learning perspective, which has been very exciting, but extending those to graph-based convolutions is feasible. There are challenges, but I think it's fantastic to see the field already marching in this direction, because graph-based approaches let us look not just at data, we can even learn from consent, we can learn about use, not just from the data. We can study the processes if we have these kinds of architectures where graph-based approaches are being examined in the same way our traditional image-based approaches, among others, are used. Really great article, if you get a chance, 2017, called Ground. It's a data context services published by Hallerstein. Just talks about how it's not just about using graphs to look at data, but also using graphs to understand how we relate nodes feeding other nodes. In other words, lineage or provenance. This is incredibly powerful. This paradigm is something that many people would like to have to defend their insights based on the data. But the interesting thing, I think, is that provenance accelerates the pace with which you can learn. It lets you know where you've been and where others have been in the insight extraction process. And that lets you stand on the shoulders of giants as you move forward. And so it's very powerful from an accelerated discovery and insight extraction and efficiency perspective. And there are some great technologies, small companies like Asura, allowing you to take graph-based approaches and bolt them on to traditional data stores, including ones that actually support governance and authorization based on a graph-based approach. So this is a very fast-moving space, but super exciting. This kind of approach where we really have engagement, where we can really think about elemental data controlled by an individual or within organizations, really can transform so many parts of the healthcare business. But fundamentally, I think it's most exciting to think about how we can use it to engage patients and others across Canada in the digital health and discovery platform activities. I know Terry Fox engages as an organization many individuals across the country, those who have had cancer, but those who haven't had cancer but care about those who've had cancer. And I think there's a huge opportunity for us to think about this. And this is contemplated in the DHDP proposal, where individuals participate as individuals in this data collaboration or economy space. So in summary, we have rapid multiple order of magnitude changes in capability with respect to digital measurement, data transport and storage, and computing, and they're creating this emergent data economy. I think the proposal and the launch of the DHDP is timely. It's designed to create a rigorous interaction between data supply and demand, really to allow collaborations to come forward and really accelerate progress against cancer and beyond across Canada. Organizations need to invest in their own data supply chains internally if this is really going to work. So I hope the organizations realize the opportunity to really engage and activate collaboration, participate in this. Even if they want to make the data open, they still need to think through this. And data governance technologies are critical to moving towards supply-demand equilibrium in the data economy. And the good news is, since 2 years ago when we wrote the proposal, the technology keeps coming, and I'm looking forward to see it mature into impact for cancer and other ailments in Canada. Thank you very much.